This discussion topic is how COVID has affected mental health and how it's seen by the public.
Oh, wow.
We talk about this all the time.
Yeah, that's a big one. I think there's been some very drastic and fast changes that's occurred, right?
There's been a lot of tragedy with mental health during this time. However, it has sprung a whole new awareness and has made it more acceptable to talk about and to get help, I feel, because people that had never experienced things that they had during this time had no choice but to reach out and get help. So I believe that there's positive change that's come from such a dark time.
Yeah, I would agree with that. I think there's a lot of the negative, which affected people that were just afraid to leave their house at first, or they were doing what they thought they had to do by staying home, and that led to some agoraphobia, and a lot of people have struggled to then get out and reacclimate back into society. There was also those that it normalized that were already staying home, and they had fears and anxiety, and it made it acceptable for them to stay home. And so they were kind of left alone for a year and a half. A lot of my patients that struggled said, this is great, actually. Everybody's doing it now. I don't feel so stigmatized by this. But then it perpetuated them just staying home more and more. A lot of addictions increased. The rate of overdose skyrocketed during the first year of COVID compared to the year before. So a lot of people that started to relapse or use more and self-medicate while they were home, and a lot of tragedies that unfolded based on that.
Alcohol sales were
through the roof, yeah. Right, they did great, unfortunately. And then there's the positive that telehealth was almost unheard of before it, and now it's really opened up an avenue. I've done a lot of that myself for individuals to seek help that they would have felt embarrassed going to an office before, or there was an excuse why they couldn't travel, and it allowed people to get help that they needed without ever going into a doctor's office, and people have really gotten better from that. Telehealth has been a huge boom because of this, and now that things have gone back to normal, so to speak, people are still getting a lot of help that way, and look for that as the best way to get help rather than some other type of circumstance. So I have people that reach out to me every day that are saying, do you do telehealth? And wanting to get better and get access to it because of that. So I think there's been a lot of positives, and I think people have talked about mental health and addiction a lot more during this time, and as Amanda, as you were saying, made it a lot less stigmatizing to be able to get the help they need. So there's been some positive changes, as well as people are struggling more. The most recent data for mental health disorders that came out was 52.9 million Americans that are struggling with a diagnosable mental health problem. The amount of individuals that are 12 and up that struggle with a substance use disorder, it's now about 41 million Americans, because a lot more people are using during this time and self-medicating through what they thought was the darkest time. If the world's going to come to an end anyway, I might as well get high.
Yeah.
And then it didn't come to an end, and you're left with a pretty substantial problem.
Yeah.
But what the pandemic did was really shed light on a lot of these issues, and then also access to care greatly increased. So we're seeing a lot more people being diagnosed with mental health concerns, but there's more access to it. So there's a lot more people doing diagnosing or getting diagnosed because of the access to care increasing. And not to say that there's a silver lining, but there is. But I don't want to downplay the deaths and the losses and all the terrible things that happened with COVID. At the same time, I'm watching and witnessing this beautiful shift in people discussing their mental health openly, without shame, without fear of being stigmatized. And I don't remember a time in my life ever where that was okay, where therapy was just another part of taking care of yourself. And I'm seeing that now, and I'm seeing workplaces shift and want to include mental health care for their employees and discuss mental wellness, and they want to change their workplace environments so that it's more conducive to their employees' mental health, and prevention is more accessible than ever before. So we're seeing this shift due to this pandemic and due to the collective stress and anxiety that we all felt as the world, actually, not just to say a country, but the whole world experience. We're seeing and witnessing a massive shift that I'm so excited to see where we are in 10 years from now. of how normalized these types of conversations are going to be.
Absolutely, and Blake and I had a conversation recently about how it's not substance use disorder and mental health and health, that this is all health. This is all health and wellness, and that it's not a separate thing, it's not a separate issue. This is all to do with your health, right? It's not your mental health and your health, physical health. You're one, you know?
I love that so much.